Right, cats. Respiratory disease complex. Copy paste. Primary viruses are herpes and Feline. Rachel did a pretty good job talking about this with eye stuff. So I'm not going to cover a lot of the popular presentations. But this is a herpes, right? So it follows the rules. It's ubiquitous. Everyone's infected. Reactivation with stress. High morbidity, low mortality. These guys are not usually systemically ill unless they have co-infections. So this is kind of the generic crusty kitten. I swear every kitten looks like this. They're disgusting. Cute, but gross. And then differentiating this from calicivirus, lesions of the tongue and oral cavity are rare with herpes. They are common with calici. Ocular lesions and ulceration, herpes, not calici. So eye versus mouth. This is a cheetah. There's a syndrome in cheetahs. I think it's young cheetahs. Do I have it up? Yeah, cheetah cubs. So cheetah cubs with feline herpes will actually present with these periocular and facial ulcers, which is pretty characteristic. Aww. This crusty kitten, not cute. This crusty kitten. This kid. No, thank you. All right, so calicivirus, widespread. There are subclinical carriers. So calici and herpes, they're like best friends, especially in young cats. You can see infection. Dual infections are not uncommon. So they're both pretty widespread. The presentation also overlaps a lot. So, however, this is more likely to cause lesions in the mouth. So here's little vesicular lesions on the tongue. These will eventually pop and turn into little ulcers. There's also a virulent systemic version. So this is like a mutant calicivirus that disseminates and causes this rapidly fatal, highly contagious disease in kittens. Not super common. Pathogenesis, probably a mutant virus, but I don't know that that's been at least elucidated. All right, Cryptococcus. So this is a cat thing primarily, but other species can be infected. Humans can get this as well. It's an important opportunistic infection in humans. There are a couple species. Gaddii is more common here where we are. It's actually in the trees, I believe. There's some kind of tree. This one's mostly carried by pigeons, bats. Yeah, you. Don't make that face at me. So the major virulence factor for these guys is they have a huge capsule. So here's the bug, this little purple dot, and here's its capsule. It's huge. Capsule's bigger than the bug. So the immune system basically does not see this as anything it needs to be worried about. They also produce melanin, which, as you know, from your use of melanin in your skin, is a free radical scavenger, which protects your DNA from sunburn. They can make melanin, and it prevents them from getting damaged by the oxidative burst of your immune cells. So the presentation is chronic granulomatous rhinitis primarily. It usually comes in upper respiratory and forms these granulomas in the nasal cavity, which then can deform and expand the nasal cavity. So animals will often present with this swollen Roman nose, like the cat upstairs. Yeah. And humans get this from cats. So this is a dimorphic fungus, infectious, not contagious, right? Okay, yeah, so this can crawl around, it can go to the eye, it can go through the cervical plate and then the brain, do whatever it wants because the immune system knows that it's there. It forms these masses that we call cryptococcosis because it's like a tumor made of crypto, and they're very gelatinous and kind of clear and jelly-like because of this capsule. Like this. There's one in the brain. This is a cryptococcosis. Here's what that looks like microscopically. So all of this is cryptococcal organisms, and all the white space is their capsules. So these tiny little dots here are the bugs. And then all this white space is their crazy capsule. Like soap bubbles. All right, toxo. Lung lesions are most common in kittens, but we don't see a lot of toxo in cats. You can get disseminated disease occasionally with immunosuppression. Marsupials are extremely sensitive to toxoplasma, so that's always on my differential list when we get a kangaroo or some weird thing. Right, feline allergic bronchitis, also known colloquially as feline asthma, so it's super common. Can present at any age, but usually it's like the middle-aged cats. This is also similar to COPD or HEAVES in horses. It's a recurrent, reversible airway obstruction. So bronchoconstriction plus inflammation. So they'll present primarily with lower respiratory signs, recurrent cough, dyspnea, wheezing. This is known to be a type 1 hypersensitivity response to inhaled allergens. Gross lesions are often minimal. So here's along with feline asthma, you can see there's some emphysema. So if you look really close, you can see little bubbles here. So these tips of the lobes that are more inflated, the areas around them have a little bit of emphysema. On cross section, here's an airway. See how small that lumen is, how much white stuff is around the airway. So this is bronchoconstriction and then inflammation around the airway. So massive, massive peribronchial puffs of inflammation. Huge. And there's often a lot of eosinophils